In my experience, patients really welcome and need good information. They need information about the disease, about the treatment, but also about coping and how to deal with the impact of cancer in their life. So any way that they can connect with others who've had similar experiences or with the voice of experts who can really provide good professional sound guidance is really welcome. Some people may feel more comfortable reading it. Some people may feel more comfortable using social media such as Facebook or Twitter to share a message and open up the community. So I think all of these different ways of forming a connection and feeling that you're not alone in this journey is really helpful. I think that having good, fluid communication between a patient and her clinician, her treatment team, and between a patient and her supportive network, her friends, her spouse, her parents, her coworkers, is really important. Again, I think that one of the things I've learned is that to do this alone is much harder than to feel connected and to feel supported. And in order to do that, to get support, you have to learn how to ask for it. That's often very hard for a young person who is still managing a career and a life and friendships and a relationship. So one of the things that we can do as professionals is help our patients, especially our very young patients, to identify their needs, to articulate them clearly. Perhaps one of the things we can do is form good, trusting relationships with them, and we can model for them how to openly discuss things that may be difficult, things that may even border on being intimate, in such a way that we can provide information, guidance, and support. So I think that there are many ways of strengthening the communication between a patient and her informal supporters, and also between a patient and her formal caregivers, the nurses, doctors, therapists, who are part of the treatment team. And it begins with trust, it begins with honesty, it begins with caring, and there has to be a certain mutuality there. Both parties need to be engaged, need to be honest, need to be open, and little by little they can sort of teach each other how best to meet their needs or to articulate them first. So communication starts with dialogue, starts with trust, and then on that you build so that you can really get to the conversations that are most meaningful, that matter the most to the patient. You ask a very important question, and that has to do with how a physician can talk to a patient about his or her prognosis. Some patients really want to know what the statistics tell us, but the statistics are no crystal ball, and they can't really inform what's going to happen to that patient. So there are many ways of answering your question. I believe in being very honest, but I also believe in being very respectful of how and what a person needs to know. And I think you do that by, again, having a very honest conversation, and by starting with a very simple question: what do you need to know? What do you need to know now? Why do you need to know it? How would you like to hear it? Instead of being very formulaic or lecturing a patient or maybe talking about Kaplan-Meier curves that may mean very little to a person who's very anxious sitting with you, mostly looking for big picture or guidance. And the other part of the answer to this question is that some of these conversations really need to be thought of as delivered in little installments. You can't just have one conversation and check the item on a checklist. It's something that you need to go back to over the course of the illness, because perhaps what a person needs to hear or know from you, if you're the clinician, changes over time. Perhaps there are other questions that come up. So one has to make sure as a clinician to let the patient know that this is something that they should feel comfortable talking about or asking about, and when they're ready for the information, that we'll be there to deliver it in the most sensitive way. The example you chose is very optimistic and should make many of the young cancer patients very hopeful about the fact that they may very well be successfully treated for the cancer and retain the ability to have a biological child. And that's an incredibly hopeful message for many of our young cancer patients. ASCO has promoted a set of guidelines so that every young patient hopefully will have this conversation with a treating team as soon as they're diagnosed, so that if it's important to them to retain their fertility or maintain their fertility, that this can be addressed. There are many different techniques that can be used. Of course, the situation will depend on what the cancer is, what the urgency is. But at this meeting and through a lot of research and educational venues, I think the culture is changing so that when we do see a young patient, we actually talk about fertility, first and foremost, and we'll do absolutely everything possible to help them maintain their fertility if that's at all possible. And if not, it's our job as well to help them cope with whatever that means to them. I think that a lot of the role of the cancer clinician these days is not just to treat the disease, but also to think about how to care for the patient in many different ways. We have really evolved our understanding of the science of caring for patients. We understand a lot more about the biology of reproduction, but we also understand a lot more about just how to talk to patients and help them maintain their hopefulness and their ability to be engaged in their treatment and their care, so that hopefully they maintain the best possible quality of life. And by that I mean not just physical health, but also mental health.